welcome to the Premi Chat, and thank you so much for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, and I have here live from Halifax, co-hosting with me, Premi parent and journalist, Leah Whitehead. Leah, thank you so much for joining us here this afternoon.
Thank you for having me, and welcome everyone. The Canadian Premature Babies Foundation is also known as CPBF, and it is a charitable organization, and its mission is to support and educate Canadian families of premature babies. This Premi Chat series is one of the many ways that CPBF shares information with NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and families who share with us their NICU experiences and knowledge. And we want you to be part of the discussion too. So please leave us a comment, let us know where you're watching from, and you can also leave a question.
Absolutely. And today, to mark the World Health Day next week, we'll be discussing how we can create a healthier future for babies and children. We are honored to have two guests discussing their work and some very promising initiatives, mobilizing many stakeholders to take action now. Our first guest is Dr. Christine Chambers, followed by Dr. Pablo Duran. Please do send your questions, insights, as we address them at the end of each presentation. And we start right now with Dr. Chambers. We will discuss the Inspiring Health Futures, a pan-Canadian cross-sector initiative to measurably improve the health and well-being of children, youth, and families. As we all know, the pandemic has highlighted inequities worldwide, including Canada, which ranked poorly on the UNICEF report card regarding health and well-being outcomes for children and youth. A transformative change would require a new approach. That's why the Canadian Institute for Health Research, CIHR, its Institute of Human Development Children in Youth, Health Youth. Okay, I totally messed up the name of the institute. Let's try again. Institute of Human Development, Child and Youth Health. I should know better because I'm part of that institute. It was also a partnership with the Children's Healthcare Canada, UNICEF, and Pediatric Chairs of Canada. They came together to create Inspiring Healthy Futures. And I have here joining us live from Halifax, Dr. Christine Chambers. I'm so sorry.
I can barely say the name of my institute correctly myself, so no worries.
So Dr. Chambers is a clinical psychologist, a Canada Research Chair in Children's Pain, and a professor of psychology and neuroscience and pediatrics at Dalhousie University. She's also the scientific director of the Canadian Institute of Health Research, the CIHR, of the Institute, there you go again, Institute of Human Development, Child and Youth Health, that we call ITSI, and the scientific director of a National Knowledge Mobilization Network, Solutions for Kids in Pain. She's a leader and innovator in patient engagement, partnerships, and mobilization of health research. Dr. Chambers, I'm so honored to have you here today. I know you are super busy, and I'm so grateful that you took the time to share your knowledge and experience with us this afternoon.
Well, thank you so much for having me. It's such a pleasure to be here and to tell you a little bit about this collaboration that we've had going. And just kudos to you, Fabiana and Leah, for all the fantastic knowledge mobilization that you're doing through this series. It's really been fantastic to watch and learn from. So I was going to just kind of jump in and give a bit of an overview about what we've been doing, and then really looking forward to having a conversation and engaging with some questions around this. So as Fabiana mentioned, I'm the scientific director of one of the institutes at the Canadian Institutes of Health Research, and the focus of my institute is on human development, child and youth health. And just as the pandemic hit, we were about to launch our own strategic planning for our institute, which is obviously focused on health research. And we put a pause on it because we could tell something big was happening. And a few months into the pandemic, where we were sort of revisiting whether we should be pursuing our own institute strategic plan again, it didn't feel right to me. It felt like we needed to join together with others who have an investment and care about children to have a bigger conversation about the health and well-being of Canadian children, youth, and families. Research is obviously a really important part of that, but it's not the only part. So really, it was a total pleasure to join forces with colleagues from the different organizations who are founding partners in inspiring healthy futures. So acknowledge my colleagues, Lisa Wolf from UNICEF Canada and Emily Grunwald from the Children's Healthcare Canada and Pediatric Chairs of Canada. And through our conversations in the summer of 2020, we just felt a strong need to come together. We as Canadians imagine a better future for our children, youth, and families, and we were tired of hearing about tomorrow for children and families. We really wanted tomorrow to start today. So we started using the hashtag Weekend for Kids, and we have a website that's really kind of a landing page where you can learn more about this work, but it's, again, a real pleasure to provide an overview here today. So what was our purpose? Why did we come together? We wanted to bring Canadian stakeholders together to create an integrated vision for a healthier future for children, youth, and families. We wanted to chart a roadmap through and forward from this pandemic that enables child, youth, and family institutions, agencies, researchers, care and service providers, and policymakers to align efforts for maximum impact. We also wanted to ensure that diverse voices were reflected in the priorities identified and that all stakeholders felt heard through our process. So why now? I mean, I mentioned the pandemic as a catalyst for this collaboration and our leadership, but just to provide a little bit of context here, in the most recent UNICEF report card, Canada ranked 30th in child well-being among 38 of the world's richest countries. That statistic is shocking to people. Most people think that in Canada, we do really well when it comes to child well-being. But relative to other countries, we're actually not performing where people expect us to. We know that Canada has one of the highest rates of adolescent suicide. We know that 1 in 5 children lives in a household with an income below the poverty line. We know that almost 1 in 3 young people do not have basic reading and math skills by age 15. And again, all of these statistics are worse with vulnerable or underrepresented populations. And we also know that on average, rich countries spend just over 2% on family-centered policies, whereas Canada lags behind at only 1.68%. And again, all of this data, the UNICEF report card was collected before the pandemic. So we know, I saw a new study out this week about the impact of the pandemic on learning loss and early literacy in children, that all of these outcomes have been made much worse through the pandemic. And one of the key reasons why Canada doesn't perform as well on the UNICEF report card as one would expect is because of the tremendous inequities in Canada. So while some children, are doing very well and are environments where they thrive, we have many children, again, these vulnerable groups, including Indigenous children, who are not doing as well. And it's that inequity, those gaps, that really contribute to our poor performance. So what was our process? Between September 2020 and March 2021, we talked with more than 1,500 diverse youth, parents, researchers, educators, advocates, policymakers, service providers, community and business leaders, and others. And, because of the pandemic, it actually facilitated our ability to have all kinds of diverse voices at the table. So normally in the before times, we would have, invited people to come together in person, which of course would have only enabled a more privileged group who had the time and the capacity and the ability to get to particular locations. But because of our Zoom and our video conferencing, we were able to invite a lot of diverse voices and have a lot of people at the tables who wouldn't normally be heard. So where did all of this land? I'll go through each of these in a little more detail in a moment, but where we landed were on 5 interlinked priorities. So you can see at the center in the red circle that at the heart of what we're doing is mobilize communities around children, youth, and families. The other interlinked priorities included impactful research and knowledge, You can see here that, you know, I come in with a strong bias that science should be valued and supported. Shouldn't be this distance thing. And certainly the pandemic has really shone a spotlight on how we need to have science and need to have science in a place that's really going to impact our lives. It's important that research reflects the needs and lived experiences of children, youth, and families, and that policies and decisions are based on evidence and knowledge. We also believe in a child-centered approach to policies and structures. And so children's best interests and the needs and voices of children, youth, and families need to guide public policy decisions. And unfortunately, we've seen lots of examples through the pandemic where children have come last. You know, what is best for children and policy that is you know, child-centered has been lacking. We also identified schools and communities as health and well-being hubs. So again, what we envisioned, and certainly during the pandemic, we realized just how critical school is. I mean, we should have always known this, but it became front and center when our children couldn't go to school in person, and how critical schools are in terms of being part of good health. And so wanting our systems to really work together, health, education, social services, justice system, working together to foster systemic equity and protect and support all children, youth, and families to thrive. And finally, I mean, we heard a lot through our initiative around accessible, adaptable health and well-being systems. So we need our systems to be interconnected. It needs to be an ecosystem where children are supported, where we're supporting resilience in families, where we have thriving schools and communities, where there's structural equity, connection to the outdoors, and really sort of full valuing of each human life. So just to run through each of these again, mobilize communities around children, youth, and families. So again, making sure that child, youth, and family voices are at the center of everything that we do. And this was something I felt very passionate about as scientific director of our institute at CIHR, that it shouldn't be scientists deciding what is done. It shouldn't even be policymakers, that we need the voices of children, youth, and families at the table. It shouldn't just be decisions about children, youth, and families, but decisions with children, youth, and families. Again, this area obviously of research and knowledge is very much in line with my institute, so that we acknowledge that research is a critical part of the ecosystem. Sometimes we think about healthcare and research off to the side, but we need impactful research and knowledge, and we need Canadians to see and feel the impact of our research, so that it's valued and so that our decision makers will value science. Again, the child-centered policies and structures, every policy and decision should be influenced by children and youth and have a family lens. As I mentioned before, the schools and communities as hubs. So schools and communities need to be dynamic hubs that are going to connect parents to resources, spaces, social connection, so many of the things that we felt deprived of during the pandemic. And again, accessible and adaptable health and well-being systems. So again, promoting interconnection, integration, family-centered systems, where both physical and mental health needs are addressed. One of the key outcomes from our report, and I really encourage you to check out our website, inspiringhealthyfutures.ca, was the identification of an acceleration agenda. So one of the things we could really feel in our conversations was this need to do things now. We can't wait any longer. This sense of urgency and action. And so really working together to identify what are our top priorities. So our acceleration agenda broadly identified the need for a plan for child, youth, and family-friendly pandemic recovery. And this is something that we've really been working towards, and our different partners at UNICEF and Children's Healthcare Canada and Pediatric Chairs of Canada have been engaging through each of their activities and outreach. One that really resonated with me was we heard a very strong need for comprehensive cross-disciplinary research that would help us to better understand and alleviate the full impact of the COVID-19 era on children, youth, and families. And I'm delighted to say that once we issued our report, the Canadian Institutes of Health Research, this really resonated with them. And we were able to create rapidly a funding opportunity on the impact of the pandemic on children, youth, and families. This initiative grew from, I think I had only $300,000 left in my budget at the end of last year. And with the support of partners and CIHR as a whole and other institutes, we were able to grow this funding opportunity into an over $10 million investment in research to understand the impact of the pandemic. We're funding 70 different research teams who are already underway now. They were funded in the fall, and my institute is providing leadership in terms of pulling together all of this incredible data that they're compiling about how we can best support. And then also another need was a national child and youth health hub to connect research, policy, systems, advocacy, and services. And our colleagues at the Sandbox project jumped in and said, we can help with this, and have led some incredible scoping work to help map out next steps and how we can build on this need to have a connection and a hub where people can come together for children, youth, and families. So I'll stop there, but did just want to acknowledge, although we had our founding partners, we also had a number of champions who stepped up and really came to the table to support our work. And this would include the Canada's Children's Hospital Foundations, Child Bright Network, Children's First Canada, the Frame Network, MyCern, again, our friends at the Sandbox Project, and the Young Canadians Roundtable on Health, who were incredibly engaged in this work and provided a critical youth voice. So I'll stop there, and really grateful for the chance to provide this overview, and looking forward to the conversation.
Dr. Chambers, thank you so much. This is so much hope for the future. So I have a question for you regarding research, because I've seen you speak several times about research, and I know we're investing so much in research, but I also remember you saying that from the research time to become mainstream is 17 years. So we don't have 17 years, right? We have to have a just quicker recovery from the pandemic. So how are we going to address that?
Yeah, it's a great question. And that is a true statistic that studies have shown that it takes on average 17 years for the results of research to, trickle down and have an impact on practice and policy. And I'll add that it's a very leaky pipeline too. So only about 14% of research, clinical research, is estimated to end up kind of having an impact on practice and policy. It's a huge problem. And, conducting science and the talents and skills needed to conduct research, and the talents and skills needed to develop the relationships and help move that research into impact, those are different skill sets. Mm-hmm. And we don't always in the research ecosystem give both of those the unique attention that they deserve. So how do we solve that? This has been a big focus in my own research area of children's pain is you can't do it alone. And a lot of researchers try to. They build things, whether it's a video or a resource or a website. And I was one of those researchers who was trying to do that. And I learned very quickly, when you're on your own, if you build it, they will not necessarily come. And so the power of moving knowledge into practice is about relationships. It's about understanding different perspectives. And frankly, again, the researchers, the skill set to be an amazing researcher may not be the same skill set that's needed. And I believe, we have a responsibility as a funder to help and to amplify. So the example I'll give you, that the $10 million investment in research on understanding the impact of the pandemic, the 70 teams that we're funding. We just actually closed a needs assessment with the researchers around what their knowledge mobilization needs are. some researchers, have well-established relationships and really understand this, but some don't. So what do you need? How can we help? What would be most useful? And we have a knowledge mobilization lead on our team who's been analyzing all of the projects, clustering them into different groups so that we can think about, okay, who needs the results of this science? How can we support and amplify and connect the results of this research with families, with policymakers? So that's just one example of how we are trying to take some leadership in making sure that our research moves, from ideas to impact more quickly.
Absolutely.
Christine, you mentioned that COVID-19 was actually helpful in terms of bringing everyone to the table. And I'm wondering if there was another way that it was helpful in terms of helping to identify maybe hidden gaps that we didn't know about until they were right in our face.
Yeah, I think that's so true. The inequities, the lack of nimbleness in our education system, right? All these things that we took for granted until they were gone. So I think some of that basic infrastructure, it's been a catalyst for innovation. I mean, now even though my kids are back at school, I got all our report cards yesterday online. That never happened before the pandemic, right? I can go to a parent-teacher meeting on Zoom now. It's way easier. So there's positives there. And I suppose, a positive was really, unfortunately, seeing the impact of the inequity, seeing the gaps, really. And also, I've described the pandemic as a leveler, right? So even people who've had significant privilege, families who previously were protected from some of these inequities, this was a leveling experience. Everybody felt this to some degree. Every child has been impacted by the pandemic. And I think it's created an important opening point to say, but some children have been excluded from school forever. And so I think it offers an opportunity for eyes open on issues that people have turned their back to many times before.
Mm-hmm.
Absolutely. I'm bringing a comment here from Sabrina. Sabrina, thank you for joining us. A constructive research approach is very fruitful, but extremely difficult to implement. Congratulations on your work. Absolutely.
That's so nice. Yeah, and I want to say we worked with an incredible consulting group called the Potential Group based in Toronto, and they have a ton of expertise in engaging diverse stakeholder audiences. And it was really through their talents and their spirit of inclusivity that I think we were able to really work together in a collaborative way.
Absolutely. It was a great work. I was part of some of those meetings, and it was very engaging, and it was amazing to see people from across Canada coming together online. As you mentioned, something that we didn't anticipate to have it before the pandemic. So I have another question for you. I don't know if it's on your scope, but I feel that a lot of those strategies that is mentioned on this initiative is very political decisions, right? In terms of more money for research or parental leave or child benefit, which is beyond the scope of all the groups that are involved, but it comes on this a much bigger, higher umbrella. So how is this group going to address all the issues on a political level to actually put those changes and the needs of the strategies in place for Canada, for Canada's children and the youth?
Yeah, I mean, it's a great question. And CIHR is actually a government agency. So we are Canada's, federal health research funding agency. So I am embedded within this government structure. And this is, one of the wonderful things about working with other colleagues. So, at Children's Healthcare Canada and Pediatric Chairs of Canada, UNICEF, they have strong, advocacy and lobbying agendas. But I will say that, from where I sit, it's always fascinating. I mean, I spend most of my time with people who care about children as much as I do, right? I mean, people like you, Leah and Fabiana, like it's an unspoken, right? Like we get it, we understand, it's at the heart of what we do, and it is eye-opening to sit at other tables where that is not as obvious. It's not, and truly, if you think of our complex healthcare system, like there's so many competing needs and priorities. But I do think, children don't vote. Their parents do, but they don't. And I think, again, we have an assumption that our children are doing better than they actually are. And so I think one of the biggest challenges is, how do we secure commitments to child and health well-being? I think we did a wonderful job in Inspiring Healthy Futures of aligning the external bodies, right? Like everybody came together around this. How do we build relationships? And certainly I'm working on this in my role at CIHR of getting to know my colleagues at FAC and Health Canada, the people who care about children just as much as we do. And how do we get children to the top of the priority list? And I think if this pandemic hasn't done it, we have a generation. I have 4 kids myself, but I mean, this generation, this is going to be the most formative event of their lives potentially. And so we owe them too. I mean, children gave up so much during the pandemic to keep other people safe. And so I'm hoping that the momentum that we have, that the coordination and alignment of our agendas will bring about that change and bring about those commitments to children.
Absolutely. Dr. Chambers, thank you so much for joining us here today. I'm going to bring a comment here that is not 100% with your talk, but I think it's very important that we bring that up because this is what we're being advocating for here at the foundation, because we do see parents' presence in the ICU as a healthy future for our preterm babies. So Anna, thank you for joining us. She said, thank you for all you do. Our work is addressing the separation that parents have experienced with their babies in the ICU. This is ongoing and worrisome. There's already amazing research looking at this. Yes, education is so needed. As a nurse, we need to support families' togetherness, and any separation has long-term implications for both babies and families. Parents currently with COVID-19 cannot see their baby for 10 days. We are advocating for another essential care provider to see and hold the baby. And this is being an ongoing conversation here at CPBF for the last 2 years. And I'm very grateful that CIHR is providing funding for a lot of research done on that front, on the separation and the impact of COVID and restrictions in ICU on families and babies. But Dr. Chambers, what is your take on it? Because I know you also a preemie parent. You've been there. And I think from your personal experience, what do you feel when you hear that those restrictions are still happening in Canada?
Yeah, I mean, it's just, again, talking about putting children and families at the heart of policies. It's heartbreaking. And I know my colleague here in Halifax, Dr. Marcia Campbell-Yeo, has been doing research in this space. And I've reflected, I mean, my twins who were late preterms are 11 now, but I've reflected a lot on what our NICU experience would have been like had the pandemic hit, and even the adjustment to being a new mother and how important getting out and the social context with other mothers and babies and all of that. So absolutely, this is a research priority, and I think we will be looking back on the pandemic and what some of our instincts were. The mistakes that perhaps have been made about what we were willing to give up so fast without questioning, the broader health impacts. So I think this is really why this type of research and these perspectives are so important, and why it's critical to have the people who are impacted at the table. So the voices of families, the voices of youth, health professionals sharing, what they're seeing, so that all of this is moving in the same direction.
Absolutely. And you are a champion at engaging everyone at the table. I wish more people were like you. So we would be in every table in research, but also on the policy level of hospitals, bring parents and families to the table to really support this, especially during the pandemic, how we can continue to bring parents and families by the bedside on a policy level for hospitals. But Dr. Chambers, thank you so much for joining us here today. Always a pleasure talking to you. And I share the website here, inspiringhealthyfutures.ca, for more information on the initiative. Thank you so much.
Thank you so much. Bye.
Wow. If that's not inspiring, I don't know what is. That got me all excited.
Absolutely.
Well, now we're going to be talking about caring for preterm and sick newborns, the present and future challenges. So, like Christine was saying, we all dream of a day when there is stable, equitable care for all families. And in order to have this, our next guest believes we need stronger dialogue between science, technology, and society, particularly when it comes to the health of newborns and specifically babies who are born prematurely, small, or sick. The Pan American Health Organization, also known as PAHO, works with the countries of the Americas to improve the health and quality of life of their populations. And it has developed guidelines to encourage policies that promote quality health care for the individual's lifespan, looking at newborns and babies who are born sick or small. Priorities like the early initiation of breastfeeding is essential. At the same time, the 5 components of the nurturing care framework, good health, adequate nutrition, safety and security, responsive caregiving, and opportunities for learning for all newborns, should be emphasized. And it's a priority to promote this kind of newborn health in community groups and regions where any of those components are threatened. And none of this can be possible without strong partnerships between healthcare and all of the sectors I mentioned before, science, technology, and society as a whole. So I have with me here today Dr. Pablo Duran, and he is going to tackle some of these subjects for us today. Dr. Duran works at the Latin American Center for Perinatology and at the PAHO World Health Organization as a regional advisor in perinatal health, performing activities initially in the perinatal area and the newborn in coordination with other specific areas under the Department of Family, Prevention, and Life course. Dr. Duran has published several scientific papers and technical documents on maternal and perinatal health and nutrition and epidemiology. Dr. Duran, welcome. Thank you for joining us here today.
Thank you very much. Good afternoon. Good afternoon, Leah. Good afternoon, Fabiana McKinney. And thank you to the Canadian Premature Babies Foundation for the invitation. I am really glad for being here. And as Leah mentioned, during these minutes, I will share with you some thoughts and the challenges and the promotion that from PAHO we are working on the region in order to promote, protect, and improve newborns' health, and mainly for those born prematurely and sick. So if we move to the next slide, please. When Julius Verne, or when we were young in the 1970s or 60s, and look at the Jetsons, we could not imagine that most of the things that we saw there in the books, in the films, in the cartoon, will be reality now. And as we are doing now, we are like the Jetsons, having this teleconference on these issues. So we know that science, technology, and the world moves faster and faster every day. We are under multiple overlapping paradigms, and but still science and technology play an enormous and important role in our daily life, in our societies. But at the same time, we know and we perceive that instability, inequity, disruptive situations, and long-term but not solved solutions and problems are still present. So it's a challenging time, and even when the pandemic has been perhaps the biggest paradigm in terms of stability and disruptive situations during the last years, we feel this this instability and these challenges every day. So let's please move to the next one. So I would like to highlight some main issues and main concerns regarding providing care to newborns and premature newborns. As I said, science and technology improves every day with a high speed. And the most important developments in terms of science and technology around the time of birth is related to arriving earlier and wider in terms of identifying the determinants, mainly the biological determinants, that can affect the life of the babies, but along the life course. We know about the importance of the 1,000 days, the preconception, prenatal, and perinatal conditions. And we know that the concept of perinatal programming that involves the situations that can impact on the health and development of the newborns, fetus and newborns, and that will impact uh, contributing to chronic conditions and well and health and well-being along the life course. We know and we read about the revolution of metabolomics. We know that the genomics, the transcriptomics, the proteomics, which are the, 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 the way of the genes, the proteins, the process of transcription and to development of proteins, or the macrobiota in the mother and in the newborn that may positively or negatively affect the health and well-being is day by day improving in terms of knowledge and also improving in terms of the implementation of these results from the science and technology in health. If we move to the next one, please. Also, the screening is expanding not only based on the common diseases that are part of the newborn screening, but also including those called new genetic screening technologies that are being uh, offered to mothers and families. But we also have to recognize that these new genetic screening technologies is not a diagnostic, that they should be taken into consideration in genetic counseling, and that the expansion of NIPT beyond the common trisomies is promising, is promoting these implementations. But we need to recognize also that even the most basic tests for newborn screening are not always available to all the families, to all the newborns at different country level, between countries or within countries. The next one, please. Moving on the same way, science, technology, and treatment is being improving. It's not only in terms of the diagnosis or identification of the genetic or proteomic conditions that may express diseases, but also today is possible, it's under development and research, but to implement therapy, genetic therapy for specific conditions, congenital conditions. So again, the science and technology is moving on providing treatment for conditions that by now are not possible to be treated, only to screen but not treated. So this is another area that is moving on in terms of science and technology. The next one, please. Uh, Another issue that is related to the speed of science is the communication of science, and the issue of the urgent, the evidence base and the big in terms of big databases and big data used to health and mainly for genetics and newborn determinants of newborn health is increasing. But at the same time, this situation within the pandemic was called as the infodemic, like a pandemic due to or related to information. And at some point, we were lost in an ocean of information that was not possible to be processed and understand with contradictory concepts and information. So the increase in communicating science may be also a challenge for the future. The next one, please. And now we are moving to the most of the problems that may be related to these situations. And this is what I call here the gen ethics, the ethics of technology, using technology mainly in terms of genetics for diagnosis or for treatment. You know the issue related to the CRISPR babies that were designed by this researcher and that went through the lines of the ethics. So this will be a main challenge in the future. The next one, please. I think it's the last. Oh, the also the accessibility and the development of technology, communication technology for e-health, telehealth, or teleconsultation. It's increasing, but again, and this will be part of the next slide, the inequity in accessing this information, and in this case, the inequity in providing evidence, it's really important. The illusion of inclusion. We think that the front lines of science is moving and more evidence is being available, but at the same time, as we can see in the title of the paper on the right, DNA databases are too wide, so genetics doesn't help everyone. How do we fix that? Is being a problem in genetics, in technology, in accessibility to information, in accessibility of ways of treating babies and families. So, and I'm concluding the first part of this presentation with this message. The science and technology is moving. Most of these products will or may contribute to the well-being of our babies, preterm babies and family, but at the same time, the challenges in terms of inequity and accessibility are still there. So the ethics needs to be taken into the consideration in this triad of science and technology, ethics, and accessibility. If we move to the next one, I would like to share with you 10 steps that we have just launched a month ago from PAHO regarding a policy. This is a policy brief in terms of strengthening newborn health in the Americas that based on that, we are promoting addressing these 10 main topics in the national policies. The next one, please. And the first two are related to the accessibility, universal health coverage, and accessibility to care along the life course, and mainly, as is the second one, in terms of reproduction health and preconception care. We know that with no investment and with no accessibility to adequate preconception health and care will be hard to improve and to prevent premature birth and other conditions that affect our newborns. The next one, please. Along with that, we know that providing care during pregnancy and labor is absolutely important. We know that perinatal asphyxia and perinatal complications are very important causes of morbidity, mortality, and disability. And this is something that we are promoting governments and managers include in their national policies, rules, and programs. And once we arrive to the newborn, the essential newborn care with all the concepts, evidence, and interventions we promote being included in the national policies, plans, and legislation in order to allow every newborn and every family to access this newborn screening, the adequate care, the conditions that we recommend for every newborn. But if we move to the next one, we need to emphasize the important, and this is why this fifth recommendations is alone, transforming care for sick and small newborns. And here we promote designing and implementing specific plans for provision of comprehensive inpatient care and intensive care for the babies, for the preterm babies, but also including or being family centered within the national plans and programs, and providing nurturing care in order to not only to base the care on the scientific component, but also including a nurturing care to the families and including the families into the process of care. The next one, please, is obviously the one related to breastfeeding, early initiation, but mainly including norms in terms of promoting and protecting breastfeeding or the access to mother's milk to every newborn, mainly to those born preterm, small, or sick. The next one, please. And here we reemphasize the importance of nurturing care framework in order to include parents and families and groups of parents and families of preterm babies in the process of care and in the process of policy making and the process of accountability in order for the governments to include the groups of parents, the group of families within the process of planning and also in the process of accountability of the results of the policies and plans implemented. The next one, please. And here we can see the final three components, most of them related to the previous presentation. One is addressing the issue of newborn health in humanitarian situations, and this may be in terms of displaced populations, but also people living in the front line, people living in indigenous communities, people living in the rural areas or far from the main cities and the high level centers, health centers. Also, strengthening healthcare workforce for newborn health. We know that there's a lack of workforce. The pandemic showed the weaknesses of the workforce, and mainly those who require special skills and knowledge in terms of providing care to preterm, small, and sick newborns. And the final one is the multi-sectorial approach and the inclusion and the involvement of the civil society in terms of designing, implementing, and making accountable the results of these interventions. The next one, please. So, and this is the final slide. We promote moving from the two to the CTS community. The two community theory of knowledge utilization talks about the science and the society as two components, as two phases of the policy implementation. We believe that without coordinating health systems, technology, science, ethics, society and social networks, and decision making with the mother, with the fetus, and with the newborn in the center, it will not be possible to reach what I mentioned at the beginning, the use of science, technology, and knowledge in terms of improving health and well-being from an equity perspective. So I think it's the last one. If we move to the next one. Yeah, thank you.
Thank you so much for that presentation. I have to say, it is a huge undertaking. All the things we're talking about, the policy change and really societal change. And so, what are some tangible things that individuals and health centers can do to start implementing these 10 components that you highlighted for us?
Thank you, Leah. It's an interesting question, which is the start, the point of the entry point, and I think that there are several entry points. We from PAHO promote, as Secretary of the governments of the Ministry of Health, promote the national governments to include the different components of the society, but also from the other side, from the groups of parents, what the foundations like CPPF or other organizations do. It's essential to communicate, to know and to be aware of these situations, and to ask for the implementation of the science, technology, and evidence. So both sides are important, along with, as I mentioned, the policymakers, the managers, the communicators, the media. So all have a responsibility for advocating for preterms and newborns, and to include these in the national policies, and to promote the dialogue between the different parts.
No, that is great, Dr. Duran, and I really appreciate all the work that you're doing in Latin America. I was part of the meeting for the launch of the policy brief in February, and there were some low-cost interventions that were mentioned during the meeting that some countries are already implementing. And if I'm not wrong, I think it was Argentina who is doing the 1,000 days. Can you talk a little bit about that? Because I found it fascinating. When there is actually a will to make the change can happen. And it doesn't need to invest billions of dollars, because what was presented there, as far as I remember, was like a low cost interventions that could include the family and benefit the entire family, not only for the newborn period, but as a life cycle of the child.
Yes, exactly. And the point you raise is very important. There are several programs in the region, like Chile Crece Contigo, or Chile Grows with You, or a program in Colombia, in Brazil, in Mexico. But the program you mentioned from Argentina, Argentina has just passed a law that is called the 1,000 days. So based on the law, they included the budget and the program, the comprehensive program that involves providing care from preconception, prenatal, perinatal, up to 2 years old, in terms of including key interventions like around the perinatal period, breastfeeding, leaves for parents to support breastfeeding, the implementation of early initiation of breastfeeding, delayed cord clamping, and those interventions that promote perinatal health, but also social and educational interventions in order to empower the families and the local communities in order to provide care and to promote care to newborns, but to the family, from the prenatal to the 2 years old babies.
Okay, I think my next question, because I'm thinking about in terms of Canada, because we have a universal health care, very different healthcare system than other countries in Latin America, and our healthcare system is all provincial. So whatever is going to be implemented in Canada is on a provincial level. So in Argentina, for example, was it a federal law that was passed? Is how do you see something like that happen in a country like Canada, where we have a very segmented healthcare system? And as I know you're in the background of Dr. Christine Chambers' talk, and you could also see how much inequity we have in this country, even though it's a rich nation, but we have a lot of indigenous community living in remote areas that don't have the same access. So how do you envision this in a country like ours?
Argentina is a federal country, so the national law makes it necessary to be implemented in the different provinces in the country, but the provincial governments are responsible for the implementation. So I don't know how it works in Canada in terms of the relationship between the national and the provincial governments, but again, this is a process of dialogue between the national, the federal, or the provincial or the sub-provincial authorities in terms of the implementation. So without, even when the law makes the obligation of the implementation as a national law, but then things need to be moved on, and this is where the civil society is so important, because if the law is there, the civil society can say, okay, here we have the law, we have the regulation, we have the policy, so we need to address what the law says. So this is a process of democracy and construction of democracy and exercising democracy. But I think it's important to have all the actors present in the discussion in order to scale up these interventions. And this is why we are promoting from PAFO that all the actors be present in the discussion and in the coordination of these approaches.
And a lot of advocacy also involved.
Mhm.
I don't know if you have a question, because I have another question.
You go ahead. I love just hearing the two of you.
So my question, and you go back to discussions, Dr. Duran, that we had in the past for the last 2 years because of the pandemic, right? We addressed that today a little bit on the zero separation. And I know in your policy brief, there's some points there about nurturing care, promotion of breastfeeding, and we know the restrictions are still happening in hospitals across the world. Right here in Canada, we still have one hospital that has a 3-hour policy for families. And we know through research how much that impacts families when they are not together with the baby, impacts breastfeeding, bonding, and so much more. So when you look at your policy brief and you see those restrictions that are very hospital level, how do we connect the dots? How can we connect them and you change those policies? Because those are, we have a pandemic, we have COVID, people don't want to get sick, but we also want parents and babies together for a healthier future. So how are we mitigating this at this point of the pandemic over 2 years later?
I think that the pandemic make it visible what it already happened before the pandemic. Uh, it may be that it worsened the situation, but at the same time, due to the fear, due to the lack of information, the pandemic make it worse what it already happened. This is my perception. So for sure, once the pandemic be over, we will need to be careful about not going back to the previous situation. We need to reinforce the need. And I think if we think from the other side, it may be an opportunity because several scientific papers, but also general communication documents, uh, raise the issue of uh, letting parents and baby being together, letting sustaining breastfeeding. So I think we need to keep this momentum in terms of promoting and keeping these interventions in place, and not once the pandemic is over, we forget. When I say we, is the general public forget to promote these interventions. So I think it's important because as it was made visible, we need to keep on that track.
Absolutely. I think we have a lot of work to do. Leo, have any further questions?
I don't have any further questions. I have to tell you, I love the illusion of inclusion. That to me, it's like a light bulb went on of just that image, that we think people were more involved, but it's more than that excludes certain people who need to be at the table.
Yes, and this is an issue that is not only in the low socioeconomic conditions, it affects all the countries, low, middle, and low and high economic conditions, because inequities uh, in the accessibility to specific tests and treatment are everywhere present. So this is something that we need to have the flag for sustaining the accessibility to testing treatment, because if not, we have different societies of different groups, those who access to this high level care, those who do not.
Absolutely.
Absolutely. So, Dr. Duran, thank you so much for joining us here today. Always enlightening. But as much as we highlighted the problems, I also feel very hopeful for the future that we are reaching a different level now of engagement with civil society and parent organizations and parents to move forward. So I'm very grateful for all that you're doing. Thank you.
Thank you very much. Have a great day.
Leah, and thank you so much for hosting with me today. It was always it's always great having you on the chat, and I hope you can join many more. And for all of you watching us live today on our YouTube channel, Facebook, or Twitter, thank you so much for being with us today, for joining the conversation. And the video of today's session and all the other videos from our Primi chats are available on our website, which is, if I find the website here, canadianprimis.org. And I want to thank our sponsor, AstraZeneca, for their ongoing support of our education sessions. And CPBF is a charitable organization, and we believe that through support and education, we can empower families, ensure they are ready to care for their babies. Please do visit our website, consider making a donation. Together, we can create a brighter future for all our families. And we see you again next Friday, 1 p.m. Eastern Time. Thank you. Stay well.